Are you always running behind schedule? Is it impacting how you feel at work? Let's think about this. It's 8:05 a.m. The first patient arrived at 7:50 and they're sitting in the waiting room. They're wondering, where are you? The schedule was full, before the morning even really began because the patients came early. The dental hygienist is still setting up because sterilization wasn't completed at the end of the day. So they're rumbling through things, trying to find the right cassette. They're looking for, the implant scalers that aren't put back in the same place as they were the last shift they were in. The dentist is in their office finishing up chart notes from yesterday, but their patient already arrived early as well. The assistant is trying to track down certain instruments that they need for the next patient's procedures so that they can be, well set up and ready to go. And the admin team is now apologizing for the clinical team not being out on time. Does this sound familiar? By 9:30 a.m., the whole day has shifted and everyone is working harder, faster, and they're more stressed out. No one was intentionally trying to be behind, but the schedule is now running the team instead of the team running the schedule. Does this sound familiar? Because it sure does to me in many practices across North America. The double standard reality. Some dentists and teams, when I talk about this, they're like, I don't know if I really like when you say this, Jen, but I am going to be bold and I'm going to bring it to your attention right here now. So we tell patients, you must be on time. Be on time. Don't come late. Please arrive early so that we can run on time. Meanwhile, teams are often set up to fail before the day even begins. This isn't a people problem in your practice. It's a system problem. Why do we run behind? Well, unrealistic appointment times that don't match the actual clinical needs. This is so true. We now know there's no buffer time in between patients, zero space for the real world to happen because we book back to back to back. And as a businesswoman, I understand this. As a dental hygienist, I think having the appropriate length of time for your patients is what you need to advocate for. Sometimes we run behind because instruments are unavailable, dull, or they're still in sterilization. We could have charting delays trying to catch up later instead of finishing it right now. Your regulatory college, your state board, they actually want you to finish your notes, dental assistants and dentists. They want you to finish while that patient is in the chair. Have you ever taken sticky notes and, put them on your patient's chart? I know most of us are digital now, but there still are some paper charts out there, and we're writing notes or putting them on our counter to get to it later. But what happens if you do this all morning long? Your 8 o'clock patient, your 9 o'clock patient, your 10 o'clock patient, oh my goodness, your 11, and then you try and finish up your 12 to 1 patient, and then you have lunch. Or do you? Most dental hygienists are seen in the kitchen writing notes from the morning, but how current and accurate are they? Sometimes we remember things about people's teeth, but we can't remember their face. So one tip, really try and finish your chart notes right inside when the patient is there. Now let's think about why we run behind some more. Interruptions happen. How many times do the dental hygienist, the admin team, or the dental assistant interrupt a dentist in a 1-hour period? You really want to make sure that you track this because this impacts also the patient who's in the dentist chair. So if you don't have any standardized systems, it truly can become chaos day after day, month after month, year over year. Now, here's the emotional toll that it takes. We know that it's busy, but running behind continually feels like we're really rushing care, that we're apologizing all day long. I'm so sorry for being delayed. I'm so sorry that I'm 10 minutes behind. You are important to me, and I'm sorry we had an emerge patient come in. It gets exhausting. And sometimes we even feel guilty, when the next patient arrives because we're not even finished this patient. And do you ever feel like you're not even able to catch your breath during the day and you go home exhausted? And this truly is where burnout begins. But a lot of times in dental practices, we think about us, the team. But I want you to flip this, and I want you to think about the patient perspective. Because if we don't have patients, guess what? We're going to have a hard time keeping our job. When we run behind, have you ever really thought about how does this make your patient feel? Most of us don't. The patient begins to question our competency, not our caring. Trust is damaged because they're wondering, like silently, in the waiting room, minute by minute, when are they coming to get me? And why are they never on time? But the hard truth is, if running on time depends on each person working harder, the system will always break. We don't need to work harder. We just really need to get a system in place that's going to work, and we need to schedule effectively. So, I have a story to tell you about a dentist who's simply amazing. She runs a practice, and I always ask teams, what are you known for? And do you know how many teams have no idea what they're known for? But this dentist is simply amazing. She is known for not letting her patients wait longer than 5 minutes. You heard me right. Not waiting longer than 5 minutes. That is 5 minutes for a dental hygiene appointment, 5 minutes to see her, 5 minutes to see the associate dentist. I know, it's crazy, isn't it? Her practice is a well-oiled machine. It does not mean that they get in to see the hygienist or the dentist at the exact time. If my appointment was at 10 a.m., I know by 10:05 a.m., I would be brought into the clinical area. That could mean that somebody is taking my x-rays. Someone is doing the digital scan while the dentist or the associate dentist or the dental hygienist is finishing up with his or her patient, but we don't leave all the patients sitting out in the waiting room for 20 minutes wondering, when am I going to go in? So I really want you to think about where in your schedule do you already know where you're going to fall behind? This is step one. If you already know there's going to be trouble, you can fix it. Be proactive. This is communication for the team to be safe, to be able to share ideas, solutions, and not crab about the schedule, but how are you going to fix it together? We also want to know which appointment types consistently take longer than you actually book for. And I know you might roll your eyes and think, well, sometimes emergencies happen and we don't know what's coming. I absolutely agree. There's going to be one off still, but you really want to think about your daily schedule. Take a look at it. What instrument or supply issue is slowing you down that no one's naming out loud? Do you need more slow speeds? Do you need more instruments? Are you hanging around in the sterilization area waiting for that equipment to come out so that you can begin? And also, what can you standardize today that would make tomorrow easier, right? And how long are you going to wait and still continue to normalize chaos in your practice? Dentistry's been around so long, yet these problems are still here. So I want you to think about the shift. Running on time is not about speed, it's about predictability. Predictability comes from system flow, not from individual heroics. You're one team working with a common goal, rowing the boat in the same direction. But running behind can get really exhausting. We cannot continue to ask patients to respect our time if we're not protecting our own time first. We say to patients, you must be here on time, yet we keep them waiting 20 minutes, 30 minutes, sometimes rescheduling them. It's really not fair. You know, we deserve a schedule also that respects the patient, the clinician, and of course, the quality of care. Running behind is not inevitable, it's fixable, but you need to be honest. So take a look at last week. This is your challenge, your call to action. Take a look and see. Print off a day sheet and really be honest. Go to the clinicians and say, where did we fall behind? What happened? Why was this patient brought in 25 minutes late? Be honest and real. Come together at a team meeting and be ready to discuss what happened, but also find those solutions. A team that works together through the good, bad, and ugly always comes out ahead.